Some 300,000 people across the UK are cared for in hospices in their final weeks and days. And very importantly, the families of those who are in the final stages of their lives also receive vital support from hospices as well. So end-of-life care impacts not just on the patient, but all of the loved ones of the patient. And that specialised, supportive, compassionate, palliative care cannot easily be replicated in a hospital setting. And that is why hospices exist, and that is why this debate really matters. It's also the case that the need for hospice services is greater now than it has ever been. More and more people have been developing serious illnesses since during the pandemic, screenings for diseases were badly disrupted, and many patients and families have subsequently found themselves referred to hospice care. And the need for hospice care, palliative care, is expected to increase over the coming years. And Hospice UK is deeply concerned that the hospice sector will simply and increasingly be unable to cope with that demand. More generally, hospices are woven into the very fabric of bereavement services across the UK. And it is truly horrifying to find that they are actually facing an existential crisis. And the reasons for this existential crisis are quite easy to understand. Hospices across the UK are facing up to 5-fold increases in their energy costs. Now, whilst for some sectors rationing and reducing energy consumption may be an option, for hospices it is clearly not. They need to keep their medical equipment running, and those in their care need to be in appropriately heated environments. And quite frankly, no one can understand why it is that hospices will be eligible for the same level of reduced support as of the 1st of April as other sectors under the new energy bills discount scheme. The same level of support as offered to pubs and restaurants. Now, no one wishes to diminish the role and the importance of pubs and restaurants, which are important parts of our community infrastructure. But we can hardly compare the services provided by a hospice with that provided by a pub. There is no equivalence. And for them to be eligible for the same level of energy support is, quite frankly, bewildering. Moreover, hospices, as we have said, cannot pass on increased costs to customers. That's simply not an option for them. But it is always an option, at least to some extent, for private business. And this reduced level of energy support that will come into effect on the 1st of April is so inadequate for hospices as to threaten their very existence. Now, I don't believe it cannot be the case, the government's intention, to leave hospices so exposed during this cost of living crisis that they simply cannot continue to operate. So I really hope that the Minister today will listen carefully to the concerns that will be raised by me and other participants in this debate, that in the upcoming budget we will have these very important matters addressed. And at this juncture, Mr Chair, I want to quote the Chief Executive of Sue Ryder, who has thrown, I think, into stark relief the challenges our hospices face. Heidi Travis said, "I think it will come as a surprise to many that their local hospice is reliant on the generosity of members of the public who choose to donate or fundraise. Put plainly, in order to pay the salaries of our doctors and nurses who provide expert care, pain and symptom management to people at the end of their lives, we rely on people buying second-hand clothes from our charity shops or running a marathon and asking their friends and family for sponsorship. It is unfathomable that such a critical part of our healthcare system is hanging by a thread." Now, I think that's quite a stark assessment of the kind of challenges that hospices are dealing with. Now, charity shops are an important part of fundraising, which I'm sure we all try to support. There's no arguing, however, that Heidi Travis makes a very important point. Indeed, the way hospices are funded would be unacceptable in any other area of our healthcare. Imagine, for example, if maternity services relied on second-hand jean sales to fund care. There would rightfully be uproar. Yet to care for dying people, hospices must rely on increasingly fragile sources of income at a time when their costs are soaring. Now, NHS services have their energy bills paid for by the government, but hospices are somehow and uniquely in providing essential care. They are somehow and unreasonably expected to absorb astronomical and eye-watering energy costs so that they can continue to carry out the very important work they do. Now, it's vital to remember that hospices receive only about 30% of their funding from statutory sources, and in Scotland that figure is 40%. But it's simply too low. And this is despite the fact that they are a critical part of our health and care system, and they also play a role in reducing pressure on our NHS, as well as providing support and training for health and care workers. It's understood that on average, 2/3 of adult hospices' income and 4/5 of children's hospice income is raised through fundraising. Now, I'm sure we can all appreciate that at best, this is an uncertain funding model. And as the cost of living bites deeper into household incomes, therefore, our community's ability to even provide that charitable support is diminished. And all of this alongside hospices' need to keep pace with NHS pay rises. 71% of hospice expenditure is spent on staff, and as pay rates rise, understandably, to keep up with inflation, hospices are and will continue to fund spiralling costs. The Scottish Government provided an additional £16.9 million to hospices during the pandemic and has committed to ensuring that any and all consequential funding for hospices will be allocated to that sector in full. However, what hospices desperately need to know is that from the 1st of April, a few short weeks away, in the spring statement, the Chancellor will deliver support for hospices to ensure that they can continue to deliver their essential services every single day of every single year. The services provided by our hospices cannot, in truth, be valued simply in terms of pounds, shilling and pence. They provide a peaceful and painless passing to our terminally ill loved ones, and I think we can all agree that we can't put a price on that. But they need help to pay their costs, not least their energy costs, beyond the offer of what is contained in the provisions of the Energy Bill Support Scheme. And also, they need a more comprehensive understanding and appreciation of the vital work they do from government, with all the support which should follow on from that in developing a more sustainable, secure funding model across the board. If we don't properly support and value our hospices, we are truly in danger of losing them. The situation is as astonishingly stark as that. So let's hope that when the spring budget is delivered, a more sustainable, long-term, secure funding model for our hospices will be delivered, because it's actually becoming increasingly urgent. And that way, if we can secure that, we know that everyone across the UK, regardless of which part of the UK they happen to end their lives happen to end, they will be able to access the best possible end-of-life care. And I asked the Minister, who would want anything less for their loved one? And I hope when he gets to his feet, when he's heard the arguments across the chamber, that he will be able to provide some hope and some reassurance to our beleaguered hospice sector. Yeah.